Please be seated. Dr. Omar Oluga, the Principal Secretary for Medical Service. Madam Mudhoni, Principal Secretary for Public Health. My very, very good friend, Dr. Davji Atela, Secretary General, KMPDU, the Acting CEO of the Digital Health Agency, Dr. David Kariuki, the CEO of KMPDC, Dr. Abdi, the Chair of Social Health Authority, Dr. Abidan Mwache, the Chair of KMPDU, colleagues from South Africa, leadership of the unions from South Africa, Botswana, and the US, distinguished delegates, and healthcare professionals, good afternoon. It is both a honor and a privilege to join you at this Annual Delegates Conference, my first such direct engagement with the Doctors' Union since my appointment as a Cabinet Secretary for Health. And I'm informed with pride that I'm the first serving Cabinet Secretary to attend this event in the history of the KMPDU. And I take that with a lot of pride, and I really want to thank the leadership, the rank and the file of this great union. This is not a coincidence, but it's a deliberate signal of my commitment and that of the government to meaningfully open and do an ongoing engagement with you, the professionals who run our health system forward. In my short time at the ministry, I have met and engaged with your leadership on several pressing issues. Some of these challenges are long-standing, others are evolving, but through trust, dialogue, and partnership, we have made very important strides. And I'm here to reaffirm my commitment and dedication to walking this journey with you. Let me be clear. The cornerstone of our universal health coverage, UHC, is the health workforce. I have said it in Parliament, I've said it in Cabinet, I've shared it with my boss, and I want to share with the people of Kenya that the cornerstone of the success of the universal health coverage is the health workforce. There can be no UHC without doctors, nurses, and all healthcare professionals being fully equipped, supported, and empowered to serve. And that's why, as a ministry, and in partnership with our county governments, we are making very strategic investment to grow and protect our human resource for health. Allow me to share some of the progress we have already made with your leadership. First, on the matter of basic salary arrears, I am pleased to report that the ministry has honored the commitment made under the 2024 Return to Work formula. The first installment of Kenya shillings 1.75 billion has been paid, and the balance is set to be cleared in this coming financial year. This follows a pledge made by His Excellency the President in his meeting with your leadership in May last year. Second was on the postgraduate medical training. We have begun remitting tuition payments for doctors in training. And with your former leader as my PS, I want to say that what I'm saying here is a commitment, it's factual, and I will be held to account. The ministry, in collaboration with county governments, received applications from medical doctors seeking sponsorship to pursue master's degree programs in various universities across the country. These applications were reviewed by the Human Resource Management Advisory Committee in 5 separate sittings, which recommended the sponsorship of 93 doctors at a total cost of Kenya shillings 142,191,456. As part of our commitment to strengthening the country's specialist workforce, the ministry has already disbursed 73,826,182 as tuition fees for the first cohort of 54 doctors, and the payment for the remaining 39 doctors is currently being processed. But to ensure inclusivity, any doctor currently undergoing specialized training with an approved course, but who may have inadvertently omitted from the current list, is encouraged to submit their request for consideration. This effort reflects our broader goal of building a fit-for-purpose and adequately skilled health workforce to support the realization of universal health coverage in Kenya. That said, colleagues, let me emphasize, and why I use colleague, I think one time the Law Society of Kenya, when I served as the majority leader of many years, and the Health Act of 2017 has my signature, the Law Society of Kenya, through many of their senior councils, wanted to make me a honorary member. Now that I'm the Minister of Health, I will not go to health facilities, but I want to be part of the family of you guys, you people. When I was in defense, I was part of the generals. When I was in environment and climate change, I was part of the global environmental leaders. And there's no way you can disown me. That one I am not going to accept. I am part of you. So if you see me when we meet in town, in the malls, if you are a doctor, you are a healthcare worker, please make sure you greet me. Because I'm part of this family. Having said that, let me emphasize that we must shift from an ad hoc approach to a structured, strategic system of postgraduate training. It has not been done well. It must be guided by the national health system needs. It must be guided by our physical space as a country. And it must be guided by equity. Discussion with the Council of Governors on this framework are already underway, and Kenya Medical Practitioners and Dentists Union will be invited to the table to make their contribution on your behalf. We are also aware of the challenges the healthcare workers face when accessing care under the Social Health Authority. It is inconceivable that those who deliver care cannot themselves access quality care. And I repeat it, it is immoral, unacceptable that those who deliver care cannot themselves access quality care. I am working closely with the Social Health Authority, who their chairman is here, the Digital Health Agency, the institution that locks you out. By the way, it's not even SHA that locks you out. It is the system, it's the super digital highway that locks you out. The CEO is here, the Council of Governors, the Ministry of Public Service, and the National Treasury to resolve these issues immediately and decisively. We must care for our carers. We must care for our carers. And today I'm happy that one of the governors who believe in the implementation of the UHC is sitting here. And I will endorse, and I will take his proposal to the Council of Governors that the share contribution for not only healthcare workers, but for all civil servants, both at the national and at the county level, be deducted at source. Because it doesn't, when I came to the ministry, I couldn't understand how government wanted UHC to be successful when its own public servants and healthcare workers are the people who are locked out. So when they go to hospital, if the nurse and the doctor and other health workers said, I don't have a cover, so SHA is not working. That was why we had a problem, and nobody was seeing that. So I think the proposal of His Excellency Governor Abdul Samad, a very progressive solution, is the one that I will take to the Council of Governors, to Public Service, to the National Treasury, to the Presidency, Dr. Mai is here, and to the Cabinet, that we deduct SHA contribution at source. And the person that will do that, all after we agree, is the CS National Treasury. Distinguished colleagues, I must also speak very candidly on the internship crisis. Delayed posting, inadequate supervision, and what I call oversupply from our institutions are all part of the broken pipeline. So we must fix the pipeline. The truth is, we are seeing the effects of unregulated expansion in training institutions, some of which admit over 4 times their capacity. And the CEO of KMPDU is here. My next port of call is to have a discussion with these institutions. If the council has told you to admit 50, you must admit 50. You cannot commercialize the training of doctors. And we are going to inspect. We are the regulators. The council is here. We will have a discussion. We will regulate the facilities. We will find, number one, whether you have all the facilities to train a medical doctor. And 2, what is your capacity? I'm already aware of training institutions that were given by the council 50 students and they admitted 200 because of commercial interest. You have to help me. We have to protect this profession. We have to protect who is training, what is training. This threatens the quality and the integrity of our healthcare system. We must uphold training standards and protect the profession. Our regulatory bodies, especially the Kenya Medical Practitioners and Dentists Council, must be empowered to enforce quality, not just quantity. The ministry is committed to working with counties to expand internship centers and improve equitable deployment. In a few days, I will convene a multi-stakeholder forum to chart a sustainable path forward. KMPDU, the union, will be at the table. Let me also reassure you, our young doctors are not forgotten. Just last week, 1,035 medical officers interns and 83 dental officers interns successfully balloted for the internship placement, together with the 503 pharmacist interns who will begin their rotations in July of 2025. And I've already factored the budget for those interns in the 2024-2025 budget. Our goal is to align internship numbers with our national budget and healthcare service delivery needs. This is not just about numbers. It's about dignity. It's about equity. It's about ensuring our doctors are trained and absorbed in ways that uphold professional standards and meet the healthcare needs of Kenyans. You will help me streamline the internship system. The National Treasury, Parliament that has a role in budget making, must have numbers and figures that in the next 5 years, 10 years, how many doctors are we going to train as interns? We can't have 1 year 2,000, another year 3,000. That we will not do it. And we will not allow people to turn this noble, dignified profession into a place where they can make some money. And that lies with the Ministry of Health. That lies with the regulator. And I want to ask the Commission for University Education, you can squat somewhere else, but not in the Ministry of Health. No way. Even if it means amending the law, we are going to amend the law. Yeah. And Dr. Kariuki, you have my support. From next week, we will visit all the training institutions. And first we will find whether you qualify to train, whether you have the right facilities. We can't have an internship program at Kenyatta or Kenyatta National Hospital where there are 50 students in a small room undergoing internship. Internship is a very vigorous individual exercise. I'm not a doctor, but I have doctors in my family. And I have friends, doctors. You know, Governor said, when you serve all these doctors, inshallah, when I have today, even I'm sure all my health individual indicators must be very good. Because all the doctors are here. And this morning, when I was coming, I told my doctor, he's a very famous old doctor called Dr. Washu, that are you in Mombasa? And he said, the young ones are in Mombasa. So this internship program, and this is a discussion I had with the president. The president has no problem. Government have no problem in paying. But we must regulate it. We must have a plan. You know, I asked a friend of mine who's an architect. I asked him, those of you who went to University of Nairobi, you know ADD. I asked him, has the number increased in ADD? He said no. He said that our numbers, we used to have 2 batches, May and I think September. But he said now even they're removing May. So we are 180 that the University of Nairobi produces in terms of architects. Dr. Kariuki, I want you to lead and with the PS here, our PS Medical Service and PS Mudhoni and the team here, we must start a discussion. That discussion, I had it with the union leadership and they agree with me. Yes, as much as we are saying government must pay, we must discuss the commercialization of the training institutions. I am not against, some of the courses taught at the university when I was there. Even during my days, there were courses where the students can be 500, 1,000. And even the lecture theaters were big. But I think the School of Health Sciences always have limited numbers. So you people help us, the leadership help us. Now we have 1,200. That's why we have a backlog. So internship placements is something we're going to discuss. I think I really want to urge all of you leaders, delegates, and members to remain engaged. Let us keep the lines of communication open. Let us work together to strengthen the foundation of our health system. All of us together, we need, and other healthcare workers in the country, we need to bring back the hope and the confidence the people of Kenya should have on the healthcare system. The government is investing in its people. You are that investment. And with your input and partnership, we will build a system that is fair, that is responsive, and that is world-class. Together we can make UHC a reality, not just in policy, but in every clinic, in every ward, and in every operating room across our country. Speaking for SHA and Digital Health Agency, and I'm happy the governor of Mombasa is here, we have noted that some of the healthcare workers, including maybe doctors, are sharing their pre-authorization codes to facilities. And this is used for fraud. I speak very straight, so I'm giving you notice. I have cases where a facility and the doctor who has given the pre-authorization code are 600 kilometers apart. The facility is in one corner, the doctor is in the other corner, the distance is 600 kilometers. And that facility is claiming that 10 surgeries have taken place. A'udhu billah. That's a very serious statement. When a Muslim says that, is that you are close to hell. And what I'm saying is serious. So I don't want to say it in public or in parliament. So when this doctor was contacted, he said, I have never been to that facility. Little did he know that the next question will be difficult to answer. The next question that was asked was, then how was your pre-authorization code shared? That is why he started wondering what's going on. Help us. Help us. Our country must be, particularly the health sector, we must exercise high degree of integrity. And doctors are known for that. When you see organ harvesting, illegal organ harvesting, you can see how integrity has been compromised. And that's why I have said it, and the PSS are here, the CEO of the council is here. No foreign doctor. Some of the foreign doctors in our country have been deregistered by their own councils. We know them. And we can only have them if we have a shortage. Kenya is a leader in the global healthcare system and in Africa. So we have enough doctors. We have enough specialists. People come and learn. We are a leader in the healthcare in our region and in our continent. So me and the PS and Dr. Kariuki, the only exception we are giving and I've done it for few governors, is if those doctors are coming on a humanitarian ground, they're coming to do a camp in Kakamega, now they're a camp in Lamu, we will agree. And I hope you have, and you need to do a serious evaluation and assessment of the foreign doctors who you gave license before. We will not agree that we are producing doctors that have no jobs and we are importing doctors. We will not. That you can take it to the bank as long as I am the Minister for Health. My turnover the last 2 years is very high, so I don't know whether I will. And you know when Devji, yeah, at least Dr. Mwai and Dr. Thuranira, who are the advisor of the president, I'm told Dr. Thuranira was he the chief matron, something. They gave him, I'm told when he was in the union he had a name. Yeah, he was a matron. And I was saying you guys are very unfair on Dr. Thuranira. You know, he's one of my advisors also. So I want to assure you that I want to clean the health sector, working with the Council of Governors, working with all stakeholders, both public and private, and I need your support and the support of all the other cadres of the healthcare workforce. Please work with me. My doors are open. Now you have the former union leader, your colleague, now as my PS. You know, when the first day I went, I met a demonstration at the door of Afi House. And I asked myself, what's going on? But I realized, then I asked, I want to go to the mosque, so how do I live here? Then they said, you can pass through Kilimo. But then I said, that route and that door belongs to the Minister for Agriculture. Kagwe is not mine. How do I use somebody else's exit? Then I asked them, what about the security team? And everybody here will say the minister is running away. So I told, that time Dr. Luga was not, so I told Mary and the other team, let's go and talk to Kenyans. They have a right. They have a genuine concern. So I can assure you, whether you come in your thousands, first I will avoid that you don't come in your thousands. I'll try to help and talk to Devji and his team that we don't reach that stage. Two, I want to assure you, and the governor is here, please give me the names of those of my colleagues, the governors, 18 governors, and I'll start with the governor of KMPDU. I'll talk to him once I leave you. Yeah, and then, you know, in a nice way, tell them that, you know, I'm from the Annual Conference of the Doctors, and they have sent me. And they are very good people. By the way, most of them were politicians, so I will, Matangi, Governor Timami, and all of them, I'll talk to them. When people talk, when people discuss, when people look for solutions, the solutions is provided by the Almighty God. So I really want to thank you. You have given me an opportunity, and I have told the President that I think things are getting to shape. You have seen us launching the National Public Health Institute, a very important institute where the coordination in terms of detection, surveillance of all epidemics will be under a global standard, will be under one roof. All the 13 divisions that deal with in the Ministry of Health will now be under one leadership that report to the PSS and report to the minister and to cabinet. So all of us in the health sector, I want to assure you that we will work for the healthcare workers, beginning today with the doctors, We will engage with the nurses, we will engage with the clinicians. But again, more importantly, as you have been told, we are introducing and we will discuss with you the scope of practice. Yeah. Everybody will have his space. Yeah. Everybody will have his space. Yeah. You cannot squat on another person's. If you cannot be a squatter in somebody's line of training. So we want everybody. And you know, everybody has a role from the moment, and you know, I was looking at, just to finish, when you go to hospital, you start first from getting out of the car, you meet a person to record you, you get the nurse, you go here, until you finish with the pharmacy, if you are an outpatient, and then that's how it is. If once the lab says this is, I'm just being a layman. The lab says you need to see that specialist, you go to that specialist, you know. So I think it is for the benefit of our healthcare system. The good people of the digital health system, finally, this technology super highway, digital health super highway. This is the technology that the governor was talking about, which is going to read out fraud and corruption. We will never have again a quack doctor. What was the name of Dr. Mugo? Dr. Mugo will never be again in Kenya. And his likes, they must look for another place. Because the council's database is in the system. We have something called track and trace on the pharmacy and poison board. We will know the drug that was dispensed and trace it up to the manufacturer. We will clean that sector. We will clean the laboratories, national quality laboratories. Mafia House will never again be called Mafia House. It will never. It will never be called Mafia House. The first day I denied it. The first week I denied. But now I am seeing, yes, I think there was a reason why Kenyans called it. I am telling you, I'm being honest. There are many corners and corridors. Dr. Luge himself was telling me he was also sometimes on the corridors. The first day I went, I saw also the Director General on the corridor. And I called him and I told him, how come you have not read the Health Act? The Health Act, sections 16 and 17, defines the Director General. And he's the first one. I told him, you're the first DG. Like the way I was the first majority leader. That section says the DG is the technical advisor to government and the CS. So even the governor of Mombasa can call Dr. Amoth. But he was part of the many corridors, the silos, there are many silos. Lucky enough, before I came, they called me. You know, when Dr. Devji now, he has said it, but you know, the first day I was appointed, instead of congratulating me, he went to the media. So he said, this is a politician. I said, okay, I'm a politician, so what about it? But then when I went to the ministry, I looked at all the ministers, their photos are there. And I think the percentage of the ministers who are medical doctors was less than 2%. And among the, I think, the good ministers was the former president, Mwai Kibaki, who served in us. I will not be, and I'm not a doctor, but I'm supposed to offer policy guidance and leadership and speak for the Ministry of Health and the healthcare workers, both in cabinet advise the president, and represent you in parliament. I am committed, and with you, I want to assure the people of Kenya that we will bring back the hope and the trust that they will have on our healthcare system. God bless you. Thank you very much. Na Mungu awabariki.